we'll figure out a schedule. I'll come down to, and hang out with you guys wherever. And I'll just send stuff to Sam and he can do it with you. You guys use somebody to, yeah. Okay. All right, so think about all the quick tests for hip and knee. Like, so if you know, sports specific stuff, like you could have someone jump, right, one-legged stand, all that stuff. If they have a knee problem, right, you know, can you walk on your heels? You know, that's helpful for motor, but also helpful for the knee, you know, tibial-femoral joint, right, and up on your toes. Again, that's helpful for motor, but also it's helpful for the patellofemoral, right? Step up, step down. And make sure they go into, can you ask them to squat? You know, make sure they go into a full squat, right? Because you want to make sure, like most people, unlike just can't keep their heels down like me. So you want to go, can you get in like a catcher's position or something like that so you really feel, get their hip to end range. And lots of people can't come up more than, they can usually get down. They're so fearful of going down because they what? They can't come up. That's the deal, right? And then you have to sort out is the coming up because the lack of going from flexion extensions back, or is it just weakness? You know, what it really is, right? So that with that hip weight person that you have, you know, that's just a quick way to, you know, it's such a great way to help at least clear the knee and the hip, you know, to see whether or not it's a problem, right? Okay, walk, gait, forwards gait, sidewards gait, you know, backwards gait, all that stuff. You know? So you guys, you know, there's lots of things to do, right? Okay, good. So let's just go through lumbar spine movements. So feet together, good. When you do this thing I gave you guys, you want to also just do. I want to see you go through the routine of like, you know, anything resting. You know, of course, these guys won't have anything unless the question says they're highly irritable. Then they have to like mimic being the patient, right? So, so anything right now? You're okay. No. Okay. And you guys, I don't know with the spine guys. Don't ask people like bend forward and touch your toes. Just say, can you please just bend forward? You just like slide your hands out in front of your legs as far as you can go, right? They probably never, some of them haven't touched their toes in all their life, and that's not the goal, right? People just can't do that, right? So don't try to like, don't tell them something that they probably have never done, right? So just slide your hands out in front of your legs as far as you can. Anything with that? No. And anything coming up? No. With that? Good. Then slide your hands down the back of your legs as far as you can. Good. And don't throw your head back. Yeah, good. Okay, and anything with that? No. Down to the right as far as you can. Good. And of course you'd look for if they really shift a lot, you know, do you use the table or not, or do you stay there? Okay. And back up and then the other way. Good. Okay, so she shifts a bit more this way. So can you just do this again? To the right, is that any different? No. Okay, good. Okay, all right. So, and then you can always ask the person, you know, like, can you show me what movement bothers you? Can you like, is there some line movement you can go to straight away if their irritability is low, right? So if they can do that, you know, then you could differentiate kind of on the spot. Is there anything you can show me that might bother you some? Just you can make some notes. Sorry?
Bending.
Oh, okay. Okay, so show me, does that come on, bring your pain on there?
Yeah.
Okay, and does it go away when you come back up?
Yes.
And you bring it back on again? And cross your arms, cross your chest. Good. So is there any weight-bearing sensitivity to it? So she has it on the right side, bring her over, take her off. You know, does that change it at all? And in the same position, what happens if I side flex, or I rotate, or I flex a bit more? You know, does that make it more? Is there anything if I bring her head down? Is there anything if I bring her foot back? You know, anything if I bend her knee a little bit more? So all that stuff, right? So in the position, can you alter anything about mechanically to see if it worsens, right? And of course, you wouldn't keep them there unless they were really on their own. Right. Okay, got it? Okay, so, and then combine...
Dennis, I'm sorry, do you have a sequence when you're trying to alter that? Do you like alter weight and then you alter
weight shift
like...
first, because you know, if it's weight bearing sensitive, that's a big deal, right? Because then that just forces you to not, you can't give exercise and weight bearing and all that stuff, right? So you probably have to do more stuff on the table, but...
Yeah.
Yeah, so, so is there, if there's a weight bearing sensitivity, then you have to kind of, is it hip? Is it back, you know, and then it's really tough to push it, right? So, but if they're weight bearing sensitive and they come in like this, you probably wouldn't do this. Like if I did that straight away, yeah, that's a good, so yeah, I understand what you're saying. If I did that right away and that kind of made things worse, I'd probably stop at that point, because things would just keep worsening as I did more. And they might say it when they walk, right? Oh yeah, it hurts me when I put my leg down or something like that, or so as they walk, and stuff, yeah, things like that, yeah.
Okay. So it's weight bearing, then spinal biases,
it's
and then
not.
neurodynamic.
It's kind of what they tell you too.
Oh,
right?
okay.
Yeah.
All right, so it
it's more of that.
depends.
Depends on.
Okay, I just want to make sure.
That's the greatest answer you could ever have the rest of your life when it comes to manual therapy.
Oh man.
Depends.
You know he loves that.
Yeah, I mean it's exactly. Somebody a student will ask you, oh, it depends.
That's fine. I just want to make sure
Goes
that
back
there
to
wasn't like a
reasoning, right?
sequence or okay.
But it all comes down to reasoning. Like I said, when you guys spend time with Nicole, I mean, she says that all the time, right? Well,
Yeah.
what's this question like, right? Or what's that like? All right, okay, so let's have you guys, and then for combined movements, so that's a combined movement that the person could offer you, right? So show me what bothers you. But then you can also take them through combined movements in flexion. So Jack kind of covered all this, right? There's primary movements, and you guys add all that stuff to it, right? So in flexion, you could side flex, you could rotate, right? So in the back, there's extension. You know, that's mainly here, you know, and you could side flex, you could rotate, all that stuff that kind of goes with it. And then and there's known things like taking them into a quadrant. If you're gonna do quadrant to the right, stand on the right side, left, left side. So it's the extension, and then you add in the drop the shoulder towards the ankle. That'd be the best way to do it. Okay, and then remember there's movements from below. Like say, for example, none of those bothered her. Lots of people don't move at 5S1. You can anterior tilt and then do the movement, or you can posterior tilt, try to hold them there, and then kind of add more flexion extension at that level. You could also have them do a hip hike, as well. So you can do all that. Remember, you can use a table as well to block for overpressures, right? So why don't you guys kind of go through all that?